Brush up on your dental care with today's professional, featuring Lima Dental Associates, where you'll always receive state-of-the-art technology with state-of-the-heart care.
Good morning, everyone, and welcome to today's professional. Today we're talking about Lima Dental Associates, so therefore with us in the studio is Dr. Eric Risolvato. Good morning to you, sir.
Good morning, George.
Doctor, we'd like to hear more about sleep apnea.
Well, thank you for asking, George. I've come on the show today to talk a little bit about sleep apnea, the condition, and the population of people that are suffering for it. The studies show us nowadays that somewhere around 25 to 35% of the population is probably suffering from obstructive oral sleep apnea.
Really?
And they're also saying that probably 80% of mild and moderate sleep apneics are undiagnosed. Undiagnosed because all they realize that's happening is snoring. At the risk of embarrassing myself, I'm going to demonstrate a little bit about what a sleep apneic might sound like while they're sleeping.
Yeah.
You may have a little bit of snoring.
Yeah.
And then no breathing.
Yeah.
And then a loud noise, and then a sudden waking. And if you're a spouse, you may have heard this before. It's not just innocuous snoring that's happening there. The body's actually stopping breathing. And as I mentioned back in January, in some severe apneics, that's happening once every 45 to 60 seconds.
Wow.
And in mild and moderate, it's happening somewhere between 5 and 20 or 30 times an hour. It's very important that this condition is looked at, and that's why you shouldn't just run to the dentist and have a snore appliance made, or just go to the store and grab an appliance to try to stop your snoring. This condition is severe. It leads to car accidents. It leads to sleepiness during the day, but more importantly, it leads to heart disease. It leads to other chronic illnesses throughout the body. For 20, 30, 40 years of not sleeping during the evening, the brain and the body really takes a toll. The fixes for these are the CPAP machine, which we discussed, and I showed the lovely picture of somebody wearing a Darth Vader type mask.
Yes, it is.
But the dental profession in the last 20 years, and what I'm involved in, has worked on the oral appliance, and I showed everybody in December that oral appliance that I myself wear.
It's almost like a retainer.
It's almost like a retainer. See, I can still talk with it in. So if you have this issue or you think you might, I definitely suggest that you talk to somebody.
Okay, anything else, Doctor?
Just remember to keep smiling, sharing, and caring, George. Thank you.
Thank you very much.